Hi, everyone. Welcome to our TED Talk. We are going to be talking about a very important topic, childhood obesity, and we are focused in the city of Glendale. This is a big growing issue that we are very passionate to talk about, so let's get started.
We asked many busy parents in the community, and they shared how they don't know how to get involved in their children's health while managing their very busy schedule. Overall, we conducted a big recurring key issue that parents struggle with were ways to reduce the screen time, increasing exercise, and incorporate healthy meals to their children's life. In 2020, data shows 23.6% of children were receiving the recommended 6 minutes of physical activity a day, and this number is continually getting worse. Just for comparison, we pulled data from 2016 on LA County SBA Key Health Indicator, and 27.5% of children aged 6 to 17 years obtained recommended amount of aerobic exercise each week, which is more than 60 minutes per day. This shows it is worsening in the past decade because there is approximately a 4% decrease in the past decade. In 2020, data showed 50% of children play sports, and also in 2020, data showed that 38.7% of children aged 2 to 5 years with total screen time of no more than 1 hour a day.
According to the LA County Department of Health, Public Health Key Indicators from 2016, 19.8% of children are obese, which equates to a BMI of 30 and above, while 37% of children are overweight, which equates to a BMI of 25 to 30. In regards to the trends of childhood obesity over the past 2 decades, in 2005, childhood obesity in Glendale was at 17.6%. And according to the LA County Department of Public Health, in 2012, 37.7% of children in Glendale were overweight or obese, according to the Ventura County Public Health statistics. Moving on to evidence from research, the ideal amount of screen time limits were found to be between 30 minutes to 1 hour per day for children aged 3 to 7 years old, and 1 hour a day for children aged 7 to 12 years old. That same study found that parents who watch excessive amounts of television at home for over 4 hours per day have children that are at a 10 times increased risk for increased screen time. 68% of children, 68% of parents disclose that their school does not offer daily physical education classes for children because of the lack of physical education classes being offered in elementary schools and middle schools. Students do not develop active skills or develop an active lifestyle, which increases the likelihood of childhood obesity. Furthermore, a reduction in sugar sweetened beverages, and changes in body fatness, reduction in high-fat food and sugary beverages, increased intake of fruits and vegetables, a reduction in snacks, and a maintenance of a balanced diet all showed positive outcomes in modifying obesity-related risk factors for obese children and adolescents. 37.5% of children drink at least one soda or sweetened beverage per day. Overall, we found that parents who implement certain eating and physical activity behaviors as well as set strict bed and screen time rules have children with reduced rates and chance of developing obesity.
Okay, so a little intervention overview on what we did. Our model was really focused on catering to busy parents specifically. So what we did was we started off by educating the parents using a universal, simple educational flyer shown below. And we printed these out and handed it to the parents at Glen Oaks Elementary, who were already attending a local PTA meeting. And this flyer just emphasizes the importance of parents being involved in their child's health, not only to prevent poor health outcomes, but to prevent long-term chronic comorbidities in the future. And this flyer also helps address how we can start implementing small changes towards those goals. So for example, on the flyer here, we specifically educated parents on ways to encourage them to increase their physical activity, decrease their screen time, incorporate healthier food choices, and all of these will help improve health outcomes and reduce the likelihood of childhood obesity. The second phase of our intervention involved educating the parents through a quick discussion. And because we know they were very busy, we focused on the discussions being approximately less than 5 minutes or around 5 minutes. And each parent was um, given a specific goal that they can try to implement each week with their children. And these goals were really based upon what problems the parents shared they were having the most difficulty with. So together, through shared decision making, we came up with an idea that each parent was able to implement each week within their family unit. A specific example that we can share, we discussed with the parents who stated that it was really difficult to get their children to exercise, and a way to incorporate a simple task would be to walk or bike to and from school, which there are programs in place um, to walk or bike to school. They can join physical activity clubs, intramural sports after school, or interscholastic sports as well. Um, as well, another specific example we can share was when we discussed with parents who were struggling with offering healthy meals. We suggested perhaps making an extra serving at dinner time in order to pack this for lunch the next day, and their children could get a home-cooked, healthier meal rather than opting for some fast food or something served in the school cafeteria that might not be as healthy of an option. So moving on from our intervention.
So there were three key aspects that we tried to take a look at when we met with parents and their children. So first was health literacy. So we kept our project tailored to like a sixth grade reading level so that parents who are not native speakers were able to um, simply read our flyer and be able to also educate their children on it and be able to understand the flyer themselves. And also we explained everything in like simple terms, so parents who did not have knowledge about a weight and BMI prior to our introduction of our topic did afterwards have a better understanding of that and were able to educate their children about it as well. And having some cultural humility allowed us to make a bond with these parents, and we did this by using respectful Armenian greetings, which comforted the parents and helped them basically overcome that language barrier that might be set there. And we incorporated cultural practices and rituals and ethnic foods within our intervention for better effectiveness. For example, when we were discussing a simple dietary modification with parents, we discussed how reducing the amount of butter used in our cultural dishes would help make healthier dishes. And understanding the balance between cultural taboo and uncomfortable topics of conversation and how to direct the conversations appropriately also helped us helped us form a better bond with the parents, and we were able to gain their trust in that manner too. So we approached our project in a very open-minded manner. We asked them very open-ended questions, and we were able to have conversations in an easy manner. And we were able to also address any sensitive topics that the parents may want to discuss. And it was just very easy flowing conversations that we had with the parents. The conversations didn't feel forced, and there was a sense of respect between us and the parents. Advocacy was another a major thing that we wanted to address. So advocating for busy parents to learn ways to meal prep healthier foods for their children, parents who are struggling financially and would expect to have like low cost meals prep for their children, more fruits and vegetables. All of that were taken into account when we were when we were approaching this project and addressing this community. So we were trying to really advocate for those parents in those populations. And we empowered parents to have the confidence to incorporate all of that dietary plans and for their family lunches, dinners, as well as to have some physical activities with their families and limit the screen time. So those are major ones that we addressed. And then moving on, trauma-informed practice was another way that we helped not only create respect amongst parents, but also to just kind of, again, ease the flow of conversation by using non-judgmental vocabulary. We were able to communicate better with the parents and by asking open-ended questions rather than assuming what their answers may be. Parents, we actually learned more about like family dynamics and how parents were handling things at home. Advocating for diet is huge. So very parents were advised to avoid certain direct questions about the child's weight as that may be a sensitive topic for both the parents and the children. And other than that, we were able to be inclusive in our discussions with the parents, and we catered and connected with the population by speaking and writing in Armenian and giving examples, translating it from English to Armenian for them, and providing tips about costs, meal preps, exercise plans, and all of that.
Okay, so these questions are measuring the following objectives that parents were educated on with our informational flyer and discussion. So basically the first one, we're focusing on identify the appropriate number of calories elementary school age children, like around 5 to 10 years old, I recommended to consume per day. Second, recognize the recommended amount of exercise time each day per CDC guidelines. Third, according to the USDA, recognize the recommended amount of vegetables to serve children per day. And the fourth one, according to the CDC, lists at least 2 positive impacts of family exercise each week. And the last one would be like correctly identify the amount of recommended screen time a child should not exceed for their children's age per the CDC. And moving on to the next slide. We basically saw an increase, like 47 increase in the knowledge of recommended daily calorie intake for the elementary school age children to be like around 1,600 calories per day. And we saw an increase in 44% in the knowledge of recommended amount of time to exercise outdoors per day to be like around 60 minutes per day. 44% increase in knowledge of recommended minimum amount of vegetables children should be eating every day is like 1 cup. And 12% increase in the knowledge of the positive impact weekly family exercise has on their child includes like strengthening family bonds and promote health and wellness and encourage like communicating and like reducing stress. Also, a 56% increase in the knowledge of recommended daily screen time for their children to not exceed like more than like 30 to 60 minutes. Overall, we had an increase in knowledge in all categories, which we are very like thrilled with. We want to emphasize the fact that there was a small increase in topic number 4. We concluded that the limitation with this was likely due to the fact that topic number 4 was an all of the above type of the question, and in future we would change this question to be like fill in the blank or check all that apply question rather than like all of the above as an option. So we would probably rewrite that question in future.
Okay, so for our star wish, a few things that we wanted to point out. Like, we think we definitely got a star for culture competency, as most residents of Glendale are Armenian. Taking this into consideration, we approached the parents in a very non-judgmental manner, emphasizing an understanding of their background, cultural norms, religion, ethnic foods, and family dynamics. When goal setting, various dietary modifications, we were able to advise parents on more healthy ingredient substitutions for traditional Armenian dishes. And in addition, we provided resources in Armenian as well as in English to limit any kind of possible language barrier. And this was especially important to us, especially since I grew up in this community. I have personal experience of language being a barrier for my own family and parents and grandparents, and constantly having to translate even as a young kid. And so because of a lack of interpreter services, we kind of saw that barrier and wanted to close that. Also, I have grown up eating the different foods in our culture, and so it makes it easier for me to be able to advise substitutions to foods that I'm personally familiar with, and it makes parents more amenable to, like, inclined to listen to the advice that we would give on that. Another star that I think we got was participant engagement, which we created a safe, effective, and welcoming learning environment that resulted in high participation from parents and yielded very positive feedback. Regardless of what the results yielded, after our last meeting, we felt very successful in the community project since all the parents are the PTA, since all the parents at the PTA meeting were thankful for our time and knowledge, because they mentioned nobody has like invested their time to address an issue as large as childhood obesity in the community. We found that it was definitely more worthwhile to have engaged these parents as established PTA meetings, as opposed to stopping parents during drop-off, pick-up times to ask questions, because they would have definitely been more rushed going in and out of school, although that was something that we had considered, and I'm glad that we did what we did in the end. And one area that is a wish for us, a place for us to kind of improve, is addressing financial barriers. So although we worked hard to set goals attainable and low cost, in the future, we are interested in accounting for any further financial challenges families may face with regards to incorporating a healthy diet in their children's life. A critique we would give our own project is that we focus on delivering quick, low cost, healthy diet and exercise options for kids, but we didn't focus on providing like specific resources for parents to find these low cost food or low cost activities in the community if resources were needed. And so an action kind of plan that we wrote out was, firstly, to continue educating parents in the community on what entails healthy living, educating parents on the research on the long-term effects of childhood obesity with deadly chronic comorbidities such as diabetes, hypertension, heart disease, respiratory disease, cancers, and so forth. Secondly, to advocate for parental involvement in their children's diet, exercise, despite their busy schedules. Also, for parents to lead by example. So implement a healthy diet, daily exercise, and less screen time in your daily life, as research shows kids with parents who adapt poor lifestyle habits are more likely to pick up those same habits. And fourth, collaborate with more schools with wider age ranges like K through 12 to reduce childhood obesity rates. Also, going off on this topic, since we saw an increase in all knowledge levels tested within the Armenian community, we're also interested in seeing if this can be transferred to other cultures as well. Through our positive results, we understand how incredibly important cultural competency and cultural sensitivity is in successfully educating our ethnic group. That being said, we would recommend modeling this for all ethnic communities in different school districts as well. And lastly, supporting development of local organizations that encourage active lifestyle and healthy dietary choices for children. A few in the Glendale community we found include YMCA, Home Knit Men. I have met many patients throughout my clinical rotations in this area specifically who have found very positive outcomes using resources that these organizations have provided. So that was very positive as well. So that brings us to the end of our presentation. Thank you so much for your time, and the next page will show you our references as well. Thank you.